During the breast design days yesterday, a session was held with 50 patients from all over the country. For the first time in Poland, there was a panel for patients based on the vision of modern patient-centered oncology. The women present here discussed and shared their experience related to the treatment for breast cancer patients. Patients participating in this project are various ages, had different lifestyle and worldview. They live in metropolises, towns and villages. They were treated in the different healthcare institutes, academic centers and district in hospital, a part of them in breast cancer units. As a result of the discussion, we created the manifesto which describes the needs and expectation of Polish breast cancer patients. We call on health professionals, especially the surgeon, to provide full knowledge about the surgical cancer treatment at the diagnostic stage and allow for shared decision-making with the patient about the best treatment approach. The patient should be provided with a possibility to know what are the differences between available methods and the related risk of complication. Please dedicate more time to it. More time to it. A more knowledgeable patient will easily accept problem coming up. An informed patient, it's not a problem. It is a value. Plan an oncoplastic procedure without compromising oncological safety. Such an approach is expression of care for patient psychological comfort. Breast cancer is not skin cancer. Women with preserved breast easier go through the healing process and afterwards faster come back to their normal lives. Devote special attention to the patient when complications appear. Presenting an action plan and showing empathy gives the patient a sense of security and increase her trust in the doctor. The post-operative treatment should be in the hospital where the patient was operated. Adjust method of breast reconstruction to the patient expectation and lifestyle. Everyone is different, and we sometimes differ in perceiving what beauty is. The patient age should not be a barrier. We should look for better understanding. Strive to apply guidelines in treatment and unify the quality of management throughout the country. Effectively cooperate with all medical personnel during the multidisciplinary tumor boards and after that during all stages of treatment. Decisions made together are better, not only at the stage of diagnosis. A good teamwork assuring the quality of treatment and feeling of safety to the patients. Closer cooperation is needed between surgeon and physiotherapists and oncologists with psychologists and dietitians. We call on policymakers and politicians to implement the ready-made project on comprehensive care within breast cancer units. Poland is the only developed country in Europe where there has been no decrease in breast cancer mortality in the last few years. Over 70,000 women are diagnosed with breast cancer every year, and we have only 6 certified cancer breast units now. We expect improvement in the quality of treatment through opening more breast cancer units all over the country. It's a good start to improve the quality of treatment. Afterwards, it's important to create a system for control and evaluation of these units. Create a specialization in breast nursing and workplaces for them, and social workers to help the patient to sort out problems related to the diagnosis and treatment. It will be easier for the patients, and doctor will have more time to talk with us. Create a psychological care system for the patients who decided to undergo surgery to reduce the risk of getting cancer due to genetic predispositions. Increase free access to the modern breast surgery. The currently non-reimbursed procedures include risk-reducing mastectomy with immediate reconstruction, symmetrization of the contralateral breast, lipomodeling. Another problem limiting patient access to treatment is the underpricing of some procedures, for example, free flap reconstruction. These procedures are not a luxury. It's not a luxury. The patient should not pay for these procedures. We are grateful for the effort you put into daily care for breast cancer patients. Thank you for that. If won't not be possible without your commitment, passion, ambition, empathy, open mind, and heart for our needs. We want to have our input in making change for the better. We believe that our voice is important. The manifesto begins our conversation. During the yesterday's session, we opened a group on Facebook with patients as members. Our aim to educate, increase awareness of surgical cancer treatment. This group is a part of project called Chirurgia piersi nie jest mi obojętnie. If you want to have our own input in this project, we invite you to cooperate. Drogie Panie, łączy nas diagnoza raka piersi oraz chęć niesienia pomocy innym kobietom, którą trudną drogę leczenia mają jeszcze przed sobą. I w imieniu swoim oraz moich koleżanek z Komitetu Doradczego Pacjentów chciałam podziękować Wam za zaufanie, jakim nas obdarzyłyście przez ostatnie kilka tygodni i wczoraj na wczorajszej sesji. Podziwiamy Was za Waszą otwartość, za emocje, jakimi się z nami podzieliłyście się swoimi doświadczeniami, po to, żeby w konstruktywny sposób inspirować innych do zmian. Ja wiem, że to nie jest łatwe. Jestem zaszczycona Waszą obecnością i z całego serca Wam za to dziękuję, że jesteście tutaj ze mną i nie jestem w tym sama. Dziękuję.